My name is Brian Turner and I'm with the Counselling Directory today as a fully qualified psychotherapist and clinical supervisor, and we're here to talk about brief solution focused therapy. So brief solution focused therapy was developed in the 1970s and 80s by a husband and wife team from Wisconsin who was Steve DeShazer and Insoo Kingberg. And these people developed a type of therapy which was designed specifically for family therapy but then found itself evolving into other aspects such as EAP programs and so forth. So what's unique about this therapy? Well, it gets you to accept a few things. First of all, that change is inevitable and you're going to have to run with it and find a solution to it. It's based on a single idea and not a combination of ideas, so you don't get confused as a client and I don't get confused as a therapist telling you about it. And also, as a therapist, I'm not the expert in the room. I may not know the answer, but I will help you to find that answer. So some of the questions that I may ask as a therapist may be, for example, a miracle question. A miracle question is a question whereby I will ask you to think outside the box with a problem. Okay, so you've got a wasp nest at the end of your garden. Fab. What would your life be like without that wasp nest? Without that stress? So the idea of that question is to get you to focus on a positive future and gets you to think about outside of your problem and look for a better problem. Now I've got exception questions. Exception questions are the second form of question that we can do, and we'll look at the problem where it wasn't so big. So I might say, we've got a lot of stress in the present about that wasp nest, but maybe 2 or 3 weeks ago, what was your stress level like then? That's a good exception question because it gets you to focus on the positives and gets you to focus on other aspects which you might not have considered. Finally, we have scaling questions. And scaling questions are amazing because they help us to track progress and other such things. If you've ever been in the National Health Service with a broken arm or other form of injury, or indeed been in a therapist room, you'll know what a scaling question is because it will usually start with, on a scale of 1 to 10, how do you feel about this problem? Or how much pain are you in? Or how much anxiety do you have? They are scaling questions. And what we do is we have a number. And we start with that number and then we can then quantify that number as the problem. And then we can see progress because you may start with a 10, which is exceptionally stressful, but that may go down to maybe 2, 3, 1. And that shows progress that you've made as a person and it gives you that motivation to carry on. Now, there are advantages and there are disadvantages to this form of therapy. Advantages, it's short. Be careful. That's also the biggest pitfall, but I'll explain in a moment. It's short, it works with CBT, DBT. You can also go for marital issues or family issues. It's fantastic with that. It's also very good for trauma and again works well with EAP programs. But what it cannot do is look at the past extensively. So if you've got a problem in childhood, you may look at a more psychodynamic form of therapy because that is important. It won't work. It won't work if you have a long-term problem. So always consider, is this the right therapy for me? If I'm not sure, read articles, do your own research, ask a trusted friend or even a professional like myself. We'd be happy to help. It's important when doing your own research to always look at a wide range of sources, and the Counselling Directory hosts a wide range of professionals who are certified therapists who are eager to help. So if you or a loved one is in trouble with a particular issue, this directory will connect you with a suitable professional to help you meet your needs. Remember, better mental health is a click away.